Greetings from Durham, North Carolina. Today we continue our Witch Talk video series, where we learn more about the witch revolution and what our collaborators are doing in response to the COVID-19 pandemic. Today we are fortunate to have Dr. Osondu Ogbuoji. He's a professor at Duke Global Health Institute and Deputy Director at the Center for Policy Impact in Global Health. We also have Dr. Gavin Yamey. He is a professor of the practice of global health and public policy and director of the Center for Policy in Global Health. Thank you so much for being with us today.
Thanks for having us.
Thanks for having us.
Absolutely. As all of you know, we have started what's called the Witch Talk video series, and we are going to start off with a set of questions. Can you please tell us what you're doing and your role is right now in the pandemic, professionally and personally? If you can tell us more about your experience with the pandemic.
Sure. Shall I kick off, Osondu?
Sure, Gavin.
So the Center for Policy Impact in Global Health was launched almost 4 years ago, and we deal with very big picture strategic questions in global health, largely to do with financing, global health governance, delivery. And from the day of our launch, we have focused on pandemic preparedness. So the topic of COVID-19 is one that we have been working on for a long time. And one of the many tragedies of the current pandemic is that there were so many researchers, not just ourselves, but many of our collaborators around the world, who were showing that with a very small investment, you could actually have had a truly fit for purpose pandemic preparedness system in place. Our center had been doing a lot of work on how much it would have cost, how would you organize it, who would pay for it, and so on. And clearly it needed to have both national capabilities and global ones. When the pandemic hit, perhaps because of our previous work, a number of agencies reached out to us. I guess the first major effort that we got involved with was the new global COVID-19 vaccine task force. So we were approached by the World Bank, by Mohammed Pateh, who is the Director for Health, Nutrition and Population at the World Bank. He approached us and asked if we could essentially lead the inaugural consultation co-organized by the World Bank and CEPI, the Coalition for Epidemic Preparedness Innovations, that is developing pandemic vaccines. They asked if we could do an analysis for the consultation, and we are now part of that vaccine task force going forwards. We've written quite a few pieces on that. I'm now a columnist for Time magazine, and my last column last week was actually on how you would ensure global access to the vaccine. So that's the first major project. The other big project we've been involved with is supporting the World Health Organization in estimating resource needs for the COVID-19 response. And we've been helping with a briefing to the G20 on that topic. I'm going to let Osondu in a minute talk about the work that we're doing with our country partners. And then let me just say that we're doing a lot of media. All of us in the center are being approached pretty much every day by reporters, and we have generally responded positively. We've done a lot of TV, radio, newspaper pieces, and so on. And the reason I think we're doing that is twofold. One, we have found that there is a real thirst for good public health information at this time. And when we do media appearances, we tend to get a lot of feedback saying, thank you for that information. And two, it is a good way for us to disseminate knowledge about what we are doing, both at the Center for Policy Impact in Global Health and at Duke Global Health Institute more broadly, and indeed across Duke generally. For example, in my piece in Time last week, I talked about Duke's efforts on COVID-19 vaccine development led by Bart Haynes and the Duke Human Vaccine Initiative. The last thing I would say is just personally, I am very involved in activism around jails, prisons, ICE detention centers, and juvenile detention centers. I've been deeply, deeply concerned for weeks now about the risk of outbreaks and deaths in those settings. And I have worked with the ACLU here in North Carolina and with the Justice Collaborative to organize a letter to the Trump administration signed by public health experts nationwide, a letter to Roy Cooper, the governor of North Carolina, also signed by public health experts. I've done a lot of interviews on that topic, and we have really been pushing for protections to be put in place in those settings now, but also taking pressure off these settings by releasing people. We think, those of us who've been involved in this matter think that people who are elderly, who are medically vulnerable, we think every single pregnant woman, all of those should not be in jail right now, particularly if they've got very little time on their sentence. And we really do think that detention centers, ICE detention centers, should be closed right now. So that is what I've been up to. Over to you, Osondu.
Thanks, Gavin. So our center also works in 6 middle-income countries, and in those 6 countries, which are Ghana, Kenya, Nigeria, Sri Lanka, Myanmar, and India, one state in India, focus is on helping to strengthen the health financing systems. And we're concerned about middle-income countries as they graduate away from being eligible for concessional financing from donors, and the fact that some of the gains that may have been gotten through donor funding and in-country investments in health might be lost once the countries graduate from eligibility to receive aid. So we've been working with those countries for close to 2 years now to strengthen internal health financing systems, to provide resource needs estimates for what they will need to fund universal health coverage over the period between 2019 and 2030, and also to identify some gaps, what we call knowledge, capacity, and policy gaps within the countries that need to be plugged if the country hopes to gain self-sustainability or self-reliance in the future. So the COVID-19 pandemic has created an opportunity for us to also address the impact that outbreaks such as this, or even smaller outbreaks, might have on financing within these countries. We have reached out to different partners in all 6 countries, the partners that we work with, just to understand what ways we can help support the response within those countries. And we are right now having discussions with those partners on how to provide support and extend the work that we're doing, which, as you would imagine, has moved towards COVID-19 related issues in most of those countries. So that's what we're doing. We're also discussing with new partners at the country level to identify how financing for COVID-19 or movement of funds away from other sectors towards COVID-19 might affect other services. Right now, we're working with some of our partners in Nigeria to work out a program to support internally displaced populations, and also other countries to try and identify how the pandemic is affecting response within humanitarian settings. And by that, I mean conflict-affected regions within countries, marginalized populations, displaced populations due to environmental catastrophes and all. So we're trying to see how the countries are set up to respond to them, and what tools or financial levers we could use, policy levers we could use to ensure that as the country responds to the pandemic, it does not leave the most at risk or the most disadvantaged behind. In the coming weeks, we are trying to assess or understand, and this understandably will happen after the pandemic, but we're trying to understand the impact the pandemic will have on households, especially households that are living in poverty. An essential part of our grant and our work is to understand how health financing strategies can be used to improve healthcare, especially for families that are living in poverty. So one thing we will be doing in the coming weeks is to do an assessment with with our in-country partners to see how the pandemic and the response to the pandemic might have affected the health and the economics at the household level.
Thank you, Dr. Yamey and Dr. Ogbuoji. It's incredible the work that both of you are doing to make sure that we're not forgetting about those communities that are, find themselves, I love what you talked about, Dr. Yamey, with the communities in jail and prison, ICE detention centers. These are things I think that a lot of people sometimes are not thinking of and the impact that it will have, as well as communities abroad in disadvantaged populations. Thank you. Our second question, how do you think COVID-19 both impacts positively and negatively other types of care, such as cervical cancer?
Osondu, why don't you talk about some of the negatives, and then I will talk about perhaps some of the silver linings. I think it would be fair to say it's very, very, very difficult right now with so many cases and so many deaths, a global economic crisis, a food crisis, an education crisis, to believe that there's anything positive. But I like to think that we are an optimistic center. So Osondu has a lot of expertise in thinking through some of the kind of shocks that could happen that could negatively affect cancer care. And then perhaps after that, I could talk about some of the silver linings.
Yeah, thanks. So I think the short answer is we don't know, but there are a few things that we might expect to happen. And if those things happen, then it's going to have an effect, a predictable effect on funding for cancer. In many middle-income countries, we already know that it's an established fact that there is insufficient funding for cancer care, and especially for cervical cancer. So that baseline has already been established, so that's small. However, when we look at what COVID-19 is, the burdens, financial and operational burdens that COVID-19 and the response to COVID-19 are placing on countries, there's very little reason to believe that things might improve. For example, right now we have countries unable to fund cervical cancer care and unable to fund general healthcare. And now they have to divert a lot of that money towards responding to a pandemic. And the World Bank and the IMF together have projected that there's going to be a global recession as a result of this global response to COVID-19 for 2021. I think they revised their estimates downwards by about 3 to 5%. In fact, Africa is proposed for the first time in 25 years to have a continent-wide recession of maybe about -3 to -5% next year. So we don't expect that there will be an increase in the pot of funds that is available for health. So if the increase in the pot of funds that is available for health is not going to happen, and it's already hard to get a lot of money, reprioritize health money towards cancer care, it's probably going to be harder in the near future before it gets easier. And also, if the other thing we need to consider is the different projections that have been made in terms of economic outlook for the country. It looks at the entire pot of funds. But what typically happens in countries as they cope with financial shocks is that the sectors that lose funds usually are the social sectors. So you have education, health, and all. They easily lose funds because a lot of the investments that have been made in capital and infrastructural development are not easy to reverse. So the health and social sector many times might lose funds, and that's why donors and co play an increasing role in events like this. Now, the countries where we work in, and in general, lower middle income countries do not have access to all the instruments that high income countries have. So for example, the US has passed, I think, 2 or 3 stimulus COVID-19 response bills, and they are not small bills. The last one was 2 point something trillion. The EU has done its own share in terms of response, and but lower middle income countries do not have access to some of these financial tools to quickly mobilize monies. The ministers of health and ministers of finance for Africa have had several meetings to figure out an appropriate response to this, and there are calls everywhere for lower middle income countries to get debt restructuring and forgiveness programs. So I guess I'm just trying to say that the short-term outlook doesn't look too good for increase in funding for cervical cancer or for cancers in general. If that is going to happen, it's probably going to happen from private sources, maybe private non-profit sources, and but it remains to be seen what will happen. Gavin?
Yeah, I mean, as I said, you've heard from Osondu the, I guess, litany of shocks ahead that really should leave us all very concerned, not just about the pandemic, but about the effect of the pandemic on the care of other diseases, and indeed on public health in general. Michael Marmot famously chaired the Commission on the Social Determinants of Health. He is on record over the last few weeks of estimating that more people are going to die as a result of social determinants of health during this pandemic than of COVID-19 itself. Unemployment is rising in many parts of the world. Rates of alcoholism are rising in many parts of the world. There are going to be so many impacts from these, related factors that it's hard to see silver linings. But as I said earlier, if there are any that you could point to, perhaps it could be around collaboration, unprecedented scientific collaboration. We've seen this with researchers joining together to find treatments, to find diagnostics, to develop a vaccine. We've seen unprecedented kind of sharing of research, use of preprints in a way that has never been done before. With health on the agenda of every single nation and at the top of the agenda of every single international agency, it is, of course, a moment in which there is a possibility that we see greater attention to things like health system strengthening, health worker strengthening, supply chain strengthening. All of these things right now are under enormous strain, but perhaps that could in turn, mobilize action, funding, research in unprecedented ways. I don't know for sure. Obviously, as Osondu said, it's just really difficult to predict. And as much as I see the outpourings of perhaps, a new sense of interconnectedness, at the same time, we have to be wary. We have seen rich countries right now monopolizing personal protective equipment, monopolizing ventilators. They are already trying to monopolize and hoard the COVID-19 vaccine. It hasn't even been developed yet, but we know that one Belgian vaccine manufacturer that will be manufacturing a COVID-19 vaccine when it's available, it says that one rich country has already pre-purchased 50% of the supply. We know that the Trump administration is reported by the New York Times to have tried to purchase CureVac, the German company that's making a COVID-19 vaccine, so that Americans can get the vaccine and no one else. And so we have to be a little bit wary. We are seeing this monopoly behavior. And I think the steps that we put in place now to ensure global access to tools and commodities is critical. Don't forget, there are shortages of supplies now that are going to affect other patients. We are seeing antibiotic shortages, we're seeing analgesic shortages, we're seeing shortages of sedatives, of blood pressure medications being used for patients in the global north. So, I think it's clearly a mixed picture.
And can I also add here that I think these challenges also create opportunities to be more innovative. So, for example, the use of telemedicine and telehealth in low and middle income countries can also be expanded. There are stories about lockdowns preventing people from accessing maternal and child health care, and vaccination services that might down the road lead to smaller ripple outbreaks, ripple outbreaks within the country. But also we have, by having a lockdown, demonstrated that it is possible to do a lot of things, right, without being physically present. So in the US, and in high income countries, you have telehealth expanding because now psychiatrists and all other clinicians that don't need to provide their service in person can do that remotely. And that is expanding to low and middle income countries. So with respect to things like cervical cancer, maybe there's room to, in the absence of being able to get more money for cervical cancer, there's room to actually get more services out of existing pot of funds by being more efficient for cervical cancer. That's also possible and should be explored.
Thank you for all that information, and fantastic point there with telemedicine, and especially as it relates to our project, the Wish Revolution, and cervical cancer. And this next question, what do you envision in the healthcare landscape will look like, in the post-COVID-19 era?
Wow. I mean, I think Osondu has touched on one of the most important trends. Every single clinician that I know has been, using telemedicine, has been, running clinics from home essentially. And every single one who I've spoken to has said it has been fantastic. And there's no going back now. In a post-COVID-19 world, there is no going back. They have said that patients prefer it, that it's more patient-friendly, that it's more patient-centered, that it's more flexible. Of course, you still have to physically see some patients, but actually not that many. And of course, there are issues about equity. Not everyone has, a mobile phone that's got internet on it or good internet access at home, etc. We have to deal with those. But I think that is one very, very clear trend, I would say, going forwards.
I will add that scarce resources, the pressure from scarce resources has, if handled very well, can create or spur innovation in ways that we cannot imagine right now. I think as donors and governments try to fund the response, that it will be nice to also fund some R&D that goes along with the response, so that it is possible for us to not just get back to where we were before faster, but also to get to a better place and do things much better than how we were doing them before. I guess the seeds that will make life after COVID-19 better or worse are being sowed right now, and so what we do right now will have long-lasting impacts.
Yeah, I mean, I would say we are certainly public health researchers. I would probably say at times I'm a public health activist, and I think there is a sense amongst the public health research / activism community that this is a moment where we need some kind of new social movement, right? Sort of building on the, HIV/AIDS activism of the last 40 years, where certainly if you look at the United States and who's being left behind and who is dying, about a third of all deaths have been in African Americans. And if you look at the poor, the marginalized, the vulnerable, the incarcerated, we need a new kind of new deal for public health, right? And we all probably need to be somehow involved in that, whether it's pressuring our local leaders or state leaders or the federal government. We clearly need universal health coverage. We clearly need universal sick pay. We clearly are going to need to support people who are socially distanced at home. I mean, this is something that we could have waves of lockdowns for years until we get a vaccine. And for many people, that's going to be unbearable. We're going to need food assistance. We're going to need rental assistance. There is so much that we're going to need I hope that that's the kind of world, you know, a politics of care and compassion that that might come out of all of this.
Thank you. Those were really the main three questions we had and wanted to talk about. We have a little bit of time left, and I wanted to ask, what is something that, you know, as the general public can do to support, you know, the healthcare system or our neighborhoods or society to play our part and I don't know, make us feel like we're doing something in this time when we do feel very overwhelmed and powerless.
Osondu.
Sure. I think whenever anyone feels overwhelmed and powerless, just doing a good deed helps a lot, because it lets you know that just lighting a candle is better than cursing the darkness, right? And so any kind of good deed will help. As far as health is concerned, a lot of the people who are working right now in the front lines are the clinicians and the public health professionals. But this is, I would say, this is a marathon, not a sprint. And so there's still going to be a lot of work that is going to happen afterwards. So how the public can be helpful, I think, will be first to be patient with the people on TV, like we're doing right now, especially when there's a lot of evidence that has been presented that doesn't seem to match with what you expect to happen. That's just the way it works. The models that are there are built on existing evidence, and as more evidence comes in, they become more accurate. However, they don't have any effect on the people who have already lost their lives and all that. But that's just the space in which we work. We work with information that we have. So understanding better how health policy is made is one thing that the public will benefit a lot from. Fact check information before you share, so that it doesn't, you're not part of people spreading information that is counterproductive to the response. And also understanding that health is very, very important, arguably one of the most important things about life, but also understanding that not everyone places the same value on it like you would expect. And so being open to having discussions with other people who may disagree, recognizing that we all live in the same space and we need to do this together, I think will be very helpful, rather than having falling into the temptation of having polarizing camps while we fight this pandemic. It will be better to present a unified front, and presenting a unified front includes, or most importantly, needs your ability or willingness to compromise. Yeah.
Thank you very much for having us. I think we both have to run to other meetings now.
Thanks, both of you.